Hi, I'm Mike Woodworth of Makari Wellness. A brief introduction for new patients and our onboarding process for people who might be prospective patients and want to come in and see what we can do for you. We should say that we don't really offer any free consultations. The only consultation that we can offer you without you coming into our office and completing a new patient exam is an herbal telemedicine consultation. That's the only thing we can do. In terms of any other condition you treat, if it's not internal medicine, we need you to come into our office so we can get a full examination of what's going on inside your body, outside your body, in the way that your nervous system is functioning or your body is moving, to determine truly what it is causing whatever the condition is that you're experiencing, and then taking our best guess and determining what we will have to do to reverse and correct that. Okay? So your treatment really begins when you read all our reviews, look up all the modalities, use this website as a resource for educating yourself, find out what ART is, acupuncture, dry needling, orthopedic stuff, look up scalp acupuncture, Chinese medicine, stroke, all of that. Do all your homework and due diligence, okay? This is very serious to us, it should be serious to you. We take your health very serious. And then make that initial visit appointment. If we can't help you, we will tell you that, okay? You won't find anyone out there saying that we took their money and didn't render a service, okay? We treat you like we would want to be treated, okay? We catalog all of our conditions into categories. We have a lot of different tools at our disposal through the years of practice and growth, and we've learned that different things respond to different tools, right? So one of the reasons we owe a lot of our success to is all the studying we've done across different professions, whether it be with acupuncturists, physical therapists, chiropractors, manual therapists, functional medicine doctors, functional neurology doctors. Okay, we're constantly finding stuff that we don't know, where we find a weakness, and we find that would be applicable to our patients and help our patient population, and we go and learn. Okay, so we constantly are reinvesting back into the learning process. That's our R&D, research and development, so that when you come to see us, you don't even know what you're getting, because we've done hundreds of thousands of dollars of training, and you're coming in at that moment and you're getting the benefit of everyone we've worked on, plus all of that training. And in the future, should you need us, guess what? Know that we're going to be better. All right. So we categorize our conditions. We have a few tracks that we follow through. So once you make that new patient exam, this is kind of what you're setting yourself up for. So you'll come in. If you're an orthopedic pain case, then you can expect that when you come in, we're going to do a full movement assessment. So you can tell us a little bit about your story, but we want you to fill your paperwork out before you come in. And we're going to do some movement assessments, some orthopedic assessments, and the tools we use tend to be orthopedic, acupuncture, dry needling, electroacupuncture and stimulation. We have photobiomodulation or laser therapy if appropriate. We do a lot of manual treatment with our hands. We use active release techniques. We do a lot of tuina or deep tissue work. Maybe it's going to be gua sha, Graston if you have a lot of scar tissue and that needs broken up. Sure, we do cupping, but a lot of people do cupping, and we don't find that it changes tissue like our other modalities. But yeah, cupping's easy. It's very passive. We put cups on you and leave. When you're with us, we'd rather work on you. It's harder for us. You're going to get more out of it. And then we give you corrections, and we expect that you're going to do your corrections at home. They're set up. We might teach you in the office, but we have video access so that you can have a reminder when you're at home. And plan on coming in for 6 treatments. That's 2 treatments a week for 3 weeks. Okay? Internal medicine. This covers everything from digestive, sleep, hormone, OB/GYN, a lot of our fertility, all stem here in internal medicine, where we might use a combination of acupuncture or herbal medicine. After we've seen a person, we really want to see these people in the office so we can take the pulse, palpate the abdomen, and get a clear picture of the tongue. But after we have an idea of where this person is and where they need to go, and we see how they're responding, we might end up just referring these people to telemedicine visits or online consultations so that we can make changes to the herbal formula. We mail a lot of herbs out across the country for people we haven't seen in months, some people we've never seen in person, but once again, you can expect to come in, depending on the condition and severity, 1 to 2 times a week, And we're gonna do that for, think 2 months or 3 months. The body changes on a cellular level in 3-month or 90-day intervals. So you'll see that your weight loss programs, your detoxification programs, and even the way we talk about babies growing, trimesters, or we talk about seasons in the world around us changing, 3-month intervals, okay? It's very important. Stroke and neurological patterns. So this is one of our specialty tracks. They're both very similar, but the stroke and neurological treatments are going to be everything from stroke, traumatic brain injury, concussion, dementia, Alzheimer's, any mental decline, anything to do basically with the brain and the nervous system. These tracks here have a lot to do with not only neurostimulation, waking up dormant neurons and cells, whether they be in your eye or in your brain, but then also blood circulation. Okay, so these treatment tracks usually will consist of some form of scalp acupuncture, our stroke systems, the Shinao Kaichao for a lot of the neurological conditions. And we're talking now, we're moving in 10 and 20 blocks of treatment. So we're saying you're going to get a block of treatment at 10 treatments. We're not interested. We don't do one-offs. This is what it takes. You're either going to commit to your care so we can get results, or we're not. We do a minimum of twice a week. In a lot of these conditions, people are going to fare much better if they can do 3, 4, 5 treatments a week. We do understand it's a resource allocation, it's time and money, but minimum of twice a week. Same thing with the ophthalmology and vision. Here we're going to really use the micro 48 acupuncture system as taught to us by Dr. Andy Rosenfarb. That's our acupuncture ophthalmology acupuncture system. We do use scalp acupuncture, once again, herbs, and there's nutritional supplements because we're dealing with the nervous system, and we must maximize the blood flow to get the nutrition into these cells in your eyes, as well as decreasing the oxidative stress and inflammation, okay? So once again, we're talking in blocks of 10 treatments. If it's a genetic condition or you happen to be upwards of mid-60s to 70 years old, we're talking 20 treatments because it's what it's going to take for your body to respond. Think of it as going to the gym 20 times and then seeing if you have abs, okay? Just get your mindset in that changing the body takes time and application and repetition. And if you do that, amazing things can happen, all right? So this is a basic outline of our tracks, but it all starts with the initial visit of going online, choosing the right location, whether you're going to come to our Oceanside location or Rancho Bernardo, picking the appropriate time. If you're not a neurological patient, vision or stroke, then you're going to pick a non-neuro new patient exam. Our stroke, TBI, concussion, that examination, that intake is much longer because we have to go through functional neurology exams and corrections. They're just more intense visits. So that's a much longer and a slightly more expensive course of action. When you get your confirmation, if you schedule that new patient visit, you'll get a confirmation right away. Make sure you do. If you don't get a confirmation, either it's in your spam folder or your confirmation, your visit was never made. And there's going to be a button in there that says, it's a link to manage your appointment. So if you didn't catch it, you're going to fill out your paperwork using that button. So you're going to go in and select manage that appointment on your confirmation, and it's going to bring you to our website, and it's going to have documents for you to fill out before you come in. We don't want you to fill out documents during your patient visit time. Fill it out online. We have a digital system. We don't have paper. We're not going to hand you paper when you come into the office, unless you're one of our neurological patients. We want you to fill that out online so that we can review your history before you come in. There's a financial form in there. People get a little hairy about filling it out. Fill it out. Our system is HIPAA compliant. We pay a lot. It's all, the financial system is connected right in line with our medical software system. Okay? This brings us to the point that we don't take insurance. We're a cash practice. We do take flex spend, health spend accounts, and we do offer packages so that your initial treatment cost can go down. Now, of course, the more you buy, the more you're committed, the more we're committed to you, right? But you are welcome to come in just for that initial visit and then weigh whether you want to undertake a program. So if you decide at that time to purchase a block of 10 or 20 treatments, that initial visit, which is usually $175, it might be $200 or $250 for certain neurological conditions. Once again, it's time. we will roll that or apply that to the price of a package and use that initial visit as your first one in the package of 10, 20, or 30 visits, okay? Hopefully this answers a lot of questions you might have as a new patient. If you don't have an answer here on the website or in these videos, then by all means, send us an email. We will get back to you at our earliest convenience, all right? Make well, be well, and be blessed. Thanks for your time.